Well, welcome. My name is Hollier. I'm the Surgeon-in-Chief here at Texas Children's Hospital. We opened this facility in 1953 with just 106 beds. Since that time, we've expanded to 3 hospitals in the Houston metro area, and soon enough, a new hospital in Austin, Texas. In the Department of Surgery, we currently have 127 surgeons, 135 advanced practice providers, and over 11 surgical subspecialties. We're the busiest surgical department in the country with almost 40,000 surgeries performed annually. We're very proud of what we built here and the care that we delivered. I hope you enjoy this virtual tour of Texas Children's Hospital. It's truly a magnificent facility.
As we enter through the main sliding glass doors of the hospital, we come into the lobby of the West Tower. To the right is the emergency center, which sees over 72,000 patients a year. And it's also the home of our Level 1 Trauma Center. Last year, our hospital received 110 Code 1 traumas. To the left of the main entrance is the elevator lobby for the West Tower. Our main inpatient tower with 8 patient care floors. All rooms have outward-facing windows and are single occupancy. Parents can sleep in the rooms with their children. On the 21st floor of the West Tower is the Residence Lounge for relaxing or working out. All residents and fellows in the hospital are welcome 24/7. This includes a shower and a bathroom as well. On the 16th floor of the West Tower is the Kids Zone, where no physicians are permitted. Children can get their minds off of being in the hospital and relax with their families. Child Life utilizes pet therapy to bring joy to our patients. Although the multiple buildings in the main campus are connected by bridges across Fannin Street, the building we will visit next is immediately adjacent to the West Tower, and that's the Abercrombie Building. This building has patient floors as well, the TCH auditorium in the basement, and the main operating rooms back on the 3rd floor. Now back to the West Tower. This is the holding area for the West Tower operating rooms. Patients pass the front desk before proceeding to one of the 10 operating rooms in this portion of the hospital. Last year, the department performed over 37,000 cases, amassing over 57,000 hours of operating time. Here you can see the numbers broken down by specialty. Over each of the past 5 years, both clinic visits and operating room cases have increased. Now let's transition to the recovery room. Near the front desk of the OR is the Physician's Lounge, which allows space for medical students, residents, and fellows to utilize multiple computers, store their goods, and grab complimentary coffee and healthy snacks. Now as we exit the main OR entrance and take a right past the wall of distinguished surgeons, we come to a display of all the surgeons on the wall, which happens to face the patient waiting area. A little further down the hall is a gift shop immediately across from the surgery academic offices. These offices house administrative personnel as well as a large conference room for meetings. Another conference room is available near the Surgeon-in-Chief offices directly across the hall. The Children's Chapel is nearby and is directly on our way to our next stop, the Mark Wallace Tower. As you enter this building, across this bridge, you will see the eating area for the food court located on this level. Here you will find a variety of choices for lunch. There are also 8 operating rooms in this building on the 7th floor. Here we see the main entrance, the holding area, and the front desk. Operations performed in the Mark Wallace Tower are usually outpatient procedures. Now we can travel to the recovery room, which is near the front desk. Consistent with the fact that the Mark Wallace Tower is our outpatient building, the clinics for every surgical discipline are located throughout this building on multiple floors. Now let's cross a portion of the Miracle Bridge to our next stop, which is the Smith Legacy Tower, built in 2018. The Legacy Tower has 21 floors, and 7 of them are intensive care units. 2 floors in this building consist of operating rooms, 1 for cardiac surgery and 1 shared by the other disciplines. A helipad on the roof allows for the rapid transport of critically ill patients to our hospital. On the 3rd floor of this building is a cafeteria, the Fresh Bistro, as well as the coffee corner. The operating rooms are on the 8th floor of this building. Near the front desk is Operating Room 1, which has an MRI in the actual room. Patients who have completed the MRI can then be transported through these doors and directly into the operating room and to the operating room table. In Legacy Tower, the holding area and recovery room are on separate sides of this large room. Patients can recover in this room unless they are directly from the ICU, in which case they will be transported directly back to their ICU room. A surgeon's lounge is also available on this floor for storage, computers, breaks, coffee, and here we see a nice view of Rice University just to the northwest. The other set of operating rooms in this building is for CV surgery and is on the 18th floor. In 2019, over 1,040 cases were performed in these operating rooms. Just like all the operating rooms in Legacy, there are window access to the outside. The intensive care units in this building are single occupancy with plenty of space for families and have the latest technology. Immediately adjacent to the Legacy Tower is the Pavilion for Women. In 2019, the Pavilion had over 6,700 births. All the rooms are private, and the infants can stay with their mothers as they're recovering. The sickest infants can be treated in a very large neonatal intensive care unit on the 8th floor of this building, while the well babies will be on floors 12 and 14. This concludes our tour. I hope we have given you a glimpse into what we consider to be a great place to work, and for trainees, a great place to learn.